How much of our health is due to health care? I'm Dr. Chad Swanson, and I'm an emergency physician. I'm on a journey to understand and transform our health system. Often, when we consider how to improve our health systems, transform it, discussions are often focused on health care. So, whether we're covered by insurance, universal health care, or the quality of our health care, the cost of our health care, I think it's important to realize the impact that healthcare has on health. And so there's one article that I'll leave a link to in the descriptions called Contributions of Healthcare to Longevity, a review of 4 estimation methods. This was published in the Annals of Family Medicine in 2019. And they found that anywhere from 0 to 17% of our life expectancy is due to healthcare. So doctors and nurses and hospitals and clinics. So that 0 to 17% of premature mortality is attributable to deficiencies in healthcare access or delivery. Another analysis by the County Rankings Health Rankings and Roadmaps found that about 20% of our length of life, or our life expectancy, and our quality of life is due to clinical care. So anywhere from, I would say, 5% to 20% of our modifiable health status is due to medical care, like the care that I provide in the emergency department. So what does contribute to our health? If it's not, what contributes to the other 80 to 95%? I'm going to show this graph here. So this is on the second reference that I'll provide. So this graph shows that health behaviors contribute to 30% of our health outcomes, length of life and quality of life. So tobacco use, diet and exercise, alcohol and drug use, sexual activity. Then clinical care contributes to 20%, like I said before, and that includes access to care and quality of care. Social and economic factors contribute to 40% of our health status. So education, employment, our income, family and social support, and community safety. And then our physical environment contributes to the final 10% of our health status. So air and water quality and housing and transit. Now these are rough estimates. It's hard to get exact data, and there's lots of limitations and caveats. But for me, at least, it provides a bird's eye view of the fact that health care does not even contribute to, at the most, 1/5, 20% of our health status. And so there's lots of implications for that. For me, it empowers me as an individual. So I can say my sleep, my diet, my exercise routine will contribute more to my health status than whether or not I'm insured or my access to health care. I think there's also important implications for communities. So whether or not we smoke, whether or not we're obese, those and many other behaviors and attitudes spread like infections. And I'll leave a link to a book called Connected that describes that data. I think it also has implications for our policies. So air and water quality, or education, or jobs, and many other policies can impact health as much or more than our clinical care. And then finally, I think there's a social justice component to this. So there are neighborhoods where people don't have access to fresh fruits and vegetables, for example, or it's not safe to go outside, and so their health is impacted by that as well. I want to emphasize that I'm very much in favor of universal health coverage. I'm in favor of high quality health care, but I do think it's important that we realize the limitations of those policies, and that we focus on things that we can control and things that really impact our health. I'd love your thoughts. This is one of one daily video that I record as a sort of informal conversation with the world about how to transform our health system to create health and well-being for all at the lowest possible cost for the system. Thank you.